I'd love to know if you guys can hear me well. I am using a new microphone today, and I was a little nervous to know if the microphone was going to work or not. And if anyone can give me a feedback to say, is it working or not? Can you hear me? So then last time they tried to do this, it didn't work. So today is my birthday, yes. And for my birthday, I am going to give away a gift to you all. I'm going to give a copy of my new book, You Are Unique and So Is Your Pain. And you see, to celebrate my birthday, I added different colors to my background here. So let me see, I have here a red. It's a little too bright, that red. Let me see. And the other one is blue. Do you like these colors that I chose today? And then I have this one here is kind of a pinkish. Okay, so you see it's my way of celebrating. I change the colors of my background depending on what I'm teaching, the mood of the day, and things like that. Thank you so much, everybody, for wishing me happy birthday today. And I love to spend time with you. And today I'm going to talk to you about journaling and why I wrote a book that is a guided journal. So before we start, let me just copy some things here in the chat. Yeah, thank you so much, everybody, for your lovely wishes. And so these are the rules for our, just typing here in the chat for our live today. You know that we have some rules here, and I want you to introduce yourself. So the first thing I'd love to get to know is get to know who is here. Can you introduce yourself and say, where are you watching from? I'd love to know which part of the world you are watching from, and yeah, you get your journal to follow along. Yes, Steph, please get it, and we will talk about the journal today. And I'll tell you why I think it is important to do a daily reflection journal. A lot of people ask me why, if they should be writing, if they should be documenting their journey. So, of course, journaling, a diary is not for everybody. A journal is for people who like to write and people who see the benefits of writing. So let me see here. We have Mike from Syracuse. We have Steph from Vancouver Island. Kareem, 2 hours from Toronto. So we have people in Canada. And yeah, thank you so much for all of you who are sending me hearts and birthday wishes. Yes, because today is my birthday. And so first of all, this live is not intended to give you medical advice. You know that. It's just for educational purposes. And if there is any problem that is causing you pain, please ask your doctor. I cannot be your doctor via internet. I can just help you to get more knowledge about your pain and learn more things about what you're doing. And if there is an emergency during this live, please stop YouTube and go to the nearest emergency department or call an ambulance. Okay, thank you so much. We have people in Atlanta. We have people from India. Thank you so much, all of you, for coming here today. So, why I ask people to do a journal? And for those of you who already got a copy of my book, you will understand what I'm talking about, because my book has a lot of places for you to write. So you see here, there are places that I ask you to write things and document, a lot of exercises for you to do. So what are the advantages of a daily reflection journal or a diary? I know many of my patients with chronic pain that life is very unpredictable, right? Life gets ups and downs, and some days they're good, some days they're bad. And being unpredictable, not knowing when you're going to have a good day or a bad day, kinds of messes up your scheduling, messes up your future, messes up your plans. Like, how are you going to plan to go to work, to travel, to visit someone, to organize a party, or go to a party, or go to a social function, if you don't know how you're going to feel? So because life with chronic pain is very unpredictable, it is really helpful that you understand what is going on, what are some of the triggers that you have when you have a flare up. And many of the exercises here in this daily reflection journal is to identify triggers for the flare ups, is to identify what has worked for you in the past that you treated a previous flare. Because I find that people quite often, they forget how they got off a previous pain flare. They do. I ask my patients, so you had a pain flare last year. What helped you to solve and to get better of that pain flare? And they forget. So one of the goals of this daily reflection journal is for you to document things that have worked for you, because what worked for you is different from what worked for another person and from another person. And also to identify those triggers. That's why the book is called You Are Unique, because each one of you who are completing this book is going to be completely different from the other person completing this book. Each one of you have your own journey. That's why the title of the book is You Are Unique, and so is your pain. And because you are unique, you do need to identify what are your personal factors affecting your pain, right? So that's one of the reasons why we're doing this. So Julieta from Philippines, Zuan from Vietnam, Jamaica. We have people from all over the world here today. So the fact that the book will help you to do this, it's an effective way for you to document your journey. But let me tell you one thing. You are not going to find, there are 90 exercises here for you to do. And you can do, once a day. So you'll finish in 90 days, 3 months. You don't need to do every day. I don't recommend people to do every day. So 90 exercises. But you are not going to find here like a diary for you to write the intensity of your pain, like a diary like every hour, how much is your hour every day, or every hour of the day you document your pain. No, because I want you to forget your pain. I want you to not be thinking about your pain, ruminating about your pain all day long. This daily reflection journal is for you to know yourself. It's for you to understand the triggers. It's for you to understand the things that worked. I don't want you to be thinking about your pain. I don't want you to be, because the more you think about pain, the more you suffer from that pain. Did you know that you then create more synapses in your pain system? And then you're reinforcing those synapses. And I want you to undo some of those synapses. So this book is different from a pain diary, for example. A pain diary, there are a lot of pain diaries for sale everywhere. And a pain diary says every day you're going to document the same thing: what you ate, what time you went to bed, how much was your pain in the morning, how much was your pain in the afternoon, how much was your pain in the evening, what medications you took. No. I don't want you to do a pain diary. This is a daily reflection journal, because journaling is effective in your pain management journey if you discover some things about yourself, if you discover your strength, if you discover your weaknesses, if you discover your powerful, your resilience. That's the plan with this daily reflection journal, okay? It's to, and it should not be a burden to you. This, I don't want you to say, oh, I need to do this every day for 90 days. And then, no, this should be pleasurable. And I understand not everyone likes to write. Not everyone likes to do a journal. And some people who love to write, they may say, this is not enough for me. I need 3-4 pages. That's fine. Get a separate pile of pages. Get a copybook with empty pages and write. But this is more to direct you how to write. I have patients that they bring to me like their journals or their pages, and they love writing, and they write and write and write, and they sit, and that's therapeutic for them. They say this is almost therapy, because one of the exercises, for example, I'll tell you, one of the exercises that I put here in the book is write a letter to yourself. Write a letter to yourself if you were a child in pain, and you want to be kind to that person, you want to be empathetic to that person. What would you write to that person? And that person is you. So write a tender, loving, care letter to yourself. And then when you're writing that letter, you use kind words, you use empathy, you use love. And then you're going to see yourself with different lenses. You're going to see yourself as a worthy person. You're going to see yourself as someone who deserves love and compassion. And I have a lot of patients that they don't feel that they deserve love and compassion and care and tenderness. They feel guilty, they feel anger, they feel frustrations, and they're harsh on themselves. So that's one of the exercises that I recommend in the book. And there are so many exercises like that. I want you to be thinking about yourself a different way. I want you to be thinking and writing about what you did in the past, what happened to you in the past, what you're thinking about the future. So this is a document for you to, it's meant to help you to forget your pain and think more about your life, right? So it's about things that sometimes people don't share with others. There might be a lot of things going on in your mind, and you'd like to tell someone, but you say, no, I'm not going to tell that person. It might be someone in your family. It could be your doctor. You'd love to say some things to your doctor. And when you see your doctor or your nurse or your physiotherapist, you don't say those things because, that would be sentiments, there would be emotions there. And you don't want to be seen as an emotional person. But you can write in your journal. So one of the exercises here is write a letter to that person. It could be someone in your family, someone in your household. It could be someone in your healthcare team that you are not brave enough to say when you are facing them. And just write what you would like to tell them. And you can use any words. And nobody needs to see. Like, this doesn't need to be, you don't need to bring this to anyone. And if you're afraid someone is going to open your journal and read what you are writing, then what I recommend is get a separate piece of paper, right? Get something that you are going to write. And then after you write, just scrap and throw away. Or you can write in your computer, on your laptop, write. And then at the end, you delete that file. But it is so important that people with pain and chronic pain get those emotions out. We've talked a lot about nociplastic pain, and we talked about how emotions are linked to pain in our body. We know that our body reflects our emotions. Emotions that are trapped in our body, they will become like a pressure cooker and they're going to come out. You can't hide emotions too long. You can't hide emotions from yourself. You can't hide emotions from other for too long. If you have emotions that are trapped in your mind, in your brain, And the more they are there, even if they are unconscious in your unconsciousness, they will have to come out. And if they don't come out as words, if you don't say those things to a psychotherapist, a psychologist, a psychiatrist, a counselor, a mentor, if you don't express those emotions with words, your body will express them. And pain is a very common way that our body expresses emotions. So writing is another way for those emotions, those thoughts, those judgments to come out of our mind. Because when you're writing, you are getting them out and through your hands and getting out. So writing is a very therapeutic modality. A lot of psychologists, a lot of counselors recommend their clients and patients to write. But if you don't like writing, I understand. Not everybody. I like writing, right? So you see, I write books and I write scientific papers. I like writing, but I understand. Not everybody likes to write, and not everybody likes to write about their own feelings. It's tough to write about what you're feeling. And in this journal, I try to be kind, and I try to do some things that are easy for you to do and for you to meditate. So I think we talked about this last time, right? This is the roundabout of pain. So some people feel trapped. We had a live session, I think 2 weeks ago, that we talked about being trapped in the roundabout. So some people are trapped. They feel trapped by pain, and they say, I cannot do this thing and I can't find a way out. So in this exercise, I will guide you. What are some things that you can write about? You can talk about so here, the things that keep people in the pain roundabout. I'm reading from page 21. For those of you who have a copy of my book, you can follow me. So the things that keep people in the pain roundabout are increased fear, loss of hope, low motivation, fatigue, emotional stress, frustrations with the healthcare system, previous ineffective treatments, and most important, lack of knowledge of alternative options. So then I ask, are you trapped in a pain roundabout? And you have to say yes or no. Then the next question for you here is, what is keeping you there? So you will have to stop and think. And I gave you some suggestions of what could be keeping you in this roundabout, but you might have different opinions and different responses. What is keeping you in this roundabout? So I want you to think about that and write. And then the next question is, can you see a way out for yourself? And so you can answer yes or no. And if you answer yes, I want you to explore what you're going to do to have a way out. And again, you are unique. Each person answering these questions will be different from another person. So yeah, thank you so much I'm reading the chat here. Oh, thank you so much for all the lovely birthday wishes. Yes, thank you so much. So many people that I recognize some names here. And yeah, my mom and my dad are watching this today, and they're wishing me happy birthday. Thank you so much, mom and dad, and lots of people here. Okay, so the goal, before I tell you about who is going to win the book, I know you probably are all waiting, who is going to win the book and what would be the rules for, because I'm going to give a copy of this book to someone who is in this live today. So stay to the end, and I'll tell you how you may get a copy of my new book. Okay, so the goals of the journal. First, the goals of this daily reflection journal is to increase your circles. When I talk about circles, and there is a page here in the book, let me get you. Okay, so these are the circles that I talk in this book. Who am I as a person? Who is involved in my life? And what can I do? Okay. Why I talk about these circles? Because these circles, I see a lot of my patients with chronic pain, these circles in their life is very reduced. Reduce. So they start putting limits to themselves. So the first limit that they put themselves is what they can do. So the person with chronic pain, they will say, oh, I can't do this. I cannot do that. I cannot do this. I cannot go there. I can't work. I can't study. I can't finish my career. I can't go to social functions because of my pain, because of my pain, because of my pain. So they start reducing the things that they can do. And because they start reducing the things that they can do, then they are socializing less and less. Their circle of people that they see every day, like if they say, I can't work because of this pain, so they're not going to work, or they're working from home, and then they see less and less people. Because when you go to work, you see people, you interact with people, and we are humans. Humans need interaction with other people. Okay? So they start reducing the amount of people that they see. And this is very bad for our brain. We know that if you start interacting with less and less people, your brain start having, losing some connections, and you get isolated. And then loneliness is a risk factor for a lot of diseases, a lot, not only pain. Excuse me. Loneliness has been linked to cancer, dementia, cardiovascular problems, pains, depression, substance uses and addictions, suicide, just because the person is losing connections with other people. And I have to tell you, social media, browsing on social media is not the same thing. Watching television is not the same thing. Watching a movie is not the same thing. You do need to interact with real people in real time. I see a lot of people now that they don't interact with people, but they say, no, I'm very social because I am on Facebook and I'm talking to my friend. No. Facebook, Instagram, YouTube, it's not the same thing. Your brain does not react to the same thing. Okay? So you do need to get out or invite people to your place or go and see people. So some of the exercises here that I will ask you to do is get out of your house, go to a place and talk to a stranger that you never talked to before. That's one of the exercises. Some people are not like that. And I say, even go to the grocery shop and talk to the cashier. Go to the pharmacy and talk to the pharmacist. Go to the park and talk to someone who is sitting there or walking a dog. So that's one of the exercises in the 90 days, okay? Because that is, some people become recluse, some people become isolated. They isolate themselves because they say because of the pain. And then their circle here becomes smaller. That's the second circle. And then because they can't do a lot of things, they put limits and they reduce their human interactions. They are now smaller as a person. They as a person, they feel they are less than they were before. Their values, that's how they perceive themselves. I'm not saying that the person is less value. No, it's how they see themselves. They see themselves as someone, oh, I can't do a lot of things. I can't talk to people. I can't see people. Therefore, I don't have any more value. I am useless. I'm hopeless. So you see how the circles are decreasing. So the goal of this daily reflection journal is to increase the circles. Okay. So it's to increase your circles, what you can do, and include the meaningful people in their lives and how they feel about themselves as a person. Another goal of the book is to help them to manage the pain flares, acute, chronic, right? To list the things that they can do that help them to manage their previous flares. and for them to see each pain flare has an opportunity for them to learn more about themselves. And finally, another goal of the book is to become more knowledgeable about pain, about pain conditions, their diagnosis, and what they can do to talk to their doctor, their healthcare professional, so they can grow in knowledge and grow as a person. Okay? So this is what I'd like to talk to you today about the book. And I think it's going to help a lot of people, but you need to get the book and use the book. Not only get the book, but you need to write in the book and you need to do those exercises. If you don't do it, it's not going to help you. Just if you buy the book and put on the shelf, like this one here, it's not going to be, it's nice, it's colorful, but you need to use it. Get a pencil, eraser, and use the book, okay? So let me read the chat here, and then I'll talk to you about how you can get a copy of the book today. Okay, so there are some questions here. Hi, Beverly from Philadelphia. Thank you so much for all your birthday wishes. How do you assess and treat psychological pain, such as this stemming from grief or trauma, and when it manifests as somatic symptoms? Yeah, great question, Riley. Very, very good. So I don't like to use the word psychological pain. So we don't use that word because every pain is real. Every pain is real. If a person tells me they're feeling pain, it doesn't matter if it is coming from a fracture or if it's coming from a traumatic experience, psychological, because they're the same. Like pain is pain and the person is suffering. And actually, I think, in my opinion, that a person that has had a psychological trauma, like PTSD, post-traumatic stress disorder, or a person that had some adverse childhood experience and now their body is expressing pain, in my opinion, I think that pain is felt more intense and more constant than a pain from a kidney stone. I think so. Like a kidney stone is what we call like a structural pain, right? There's a little stone coming from the kidney to the bladder, and it has to travel through the ureter, and as it's traveling from the kidney to the bladder, it hurts a lot. But a kidney stone, first of all, the person knows it's time limited. They know once that kidney stone is out, the pain will go away. So they have a hope that the pain will go away. Second, the person with a kidney stone, depending on the position, depending on, some people lying down, some people they immerse in a bathtub, some people take a Percocet or an opioid, and they know that will be alleviated. They will have some temporary relief for the kidney stone. So that gives them hope and gives them a break. And they know what it is. They know it's a kidney stone. I know exactly what it is. I find that people with chronic pain who have nociplastic pain, that there's no structural problem. Nociplastic pain is the term that we use. Nociplastic pain is the term that we use when the pain is not coming from a structural problem. It's not nociceptive. It's not neuropathic. I have videos about that. If you don't know what I'm talking about, go and watch my other videos. So if the pain is nociplastic, the structural problem is solved, it's healed, but there is that memory of that pain. And the pain system became sensitized. So now the problem is centralized. It's not an emotional pain, but it can be aggravated by emotions. So if a person has a nociplastic pain and they also have PTSD, or they had adverse childhood experiences, or they have anxiety, depression, that nociplastic pain is amplified. And I find this is worse than a kidney stone. Because first, they are confused. What is it? Where the pain is coming from? Second, they don't see an end to that pain. It's constant. It's year after year. And they don't have a break. Or sometimes they have a break, but they have no idea what they did to have that break. So having nociplastic pain, I find it's much worse than having a nociceptive or neuropathic pain. So thank you for that question. And how do we do to assess? Riley, I have some videos about that. I think I have lots of videos on my channel how we diagnose fibromyalgia, because fibromyalgia is a kind of nociplastic pain. So first of all, we exclude nociceptive or neuropathic origin of the pain. And when we examine the person, we do a lot of questionnaires and we examine the person, we find signs and symptoms that are specific for nociplastic pain. So I'm trying to train and educate and teach doctors and healthcare professionals how to diagnose this, because it's really important that they do. So it is possible, and then we'll say, yeah, you have nociplastic pain, and then we have to treat as a nociplastic pain. Okay, so thank you so much. Yeah, another question here. Is there a link that can be dropped in the chat for the book? So it depends on where you are in the world. I have people here from all over the world. You have to find a bookstore where you are. I will put here a link in the chat. I hope this will work. I don't know if these links work here in the chat. This is if you are in Canada, you can find this book in Canada. Canada, we have Indigo chapters, but many independent, this is Amazon, but there are many independent booksellers all over the world. You can ask them to bring a copy of the book and they should be able to. So anywhere where you'd buy regular books in your city, in your town, in your country, they should be able to bring a copy of your book, or online, as I mentioned here. So yeah. So yeah, Steph is saying that she got it from her local bookstore. Yeah, so just go to the bookstore, give them the name of the book, and they should be able to bring that to you. And I highly encourage you to promote your local bookstores. Not only order online to big boxes, bookstores, but promote your local bookstores. Go to that corner bookstore on your town and ask them to bring. They love to do this, and they should be able to bring a copy of the book. Okay, so I think it's time for me to tell you how are you going to win the book. Okay, so first of all, the rules. I wrote the rules here for you to get the book. So I would be able to send the book. I will sign a copy and I will put in the mail. Someone from my team, I'll ask my support team to sign, to send a copy to you. I'm only able to send to Canada and United States. So if you have an address in Canada and United States, in the past, I tried to send to other countries, but it was, the books got lost and we had to send another copy. So it was really frustrating, because after many months, the person had not received. So to make sure that we send the book to you, you get it, I am only able to send if you are in Canada or the United States. So I'm sorry for those of you who are not. If you have an address in Canada, United States, maybe you have a friend, you can still get the book, and then your friend can maybe bring the book to you, to your country. But if you don't, I'm sorry. The second thing is, how will I know how we'll win the book? I will tell you a question, and then if you know the answer, the first person that will answer correctly in the chat is the winner of the book. So the first one, I will be monitoring the chat, and then I'll ask you a question. But wait for the question. Don't write yet. And there is a delay, 10 seconds delay in the chat. So if you write something, YouTube will not let you write something for 10 seconds. This is to avoid people to be, sometimes people enter on YouTube and they keep writing, and so there's a delay of 10 seconds. So, okay, so and when I announce the winner for the book, please do not, to protect your privacy, don't write your email or address or telephone number in the chat. I need to protect your privacy. So if I announce who is the winner, when I announce the winner, what I will do is I will ask the winner to send an email to my team, and I will write the email. And then you send me an email saying, I'm the winner of your book. And then I will check if you are the same person that we won the book here, and then I will get I'll get your address, your mailing address from the email. So please Do not write anything in the chat that is a private. You should keep your email, telephone number, address private. Never post those things on social media or chats or those things, okay? So yeah, so good luck, everybody. So are you ready for the question? And again, I will only be able to send the book if you're in Canada or United States. And the first person that gets the correct answer here will win the book. And then I'll ask you, if some people, I can't read your name. I think everybody here, you use your name for your YouTube. But if your YouTube identity here is not your name, I'll ask you at least to tell me your first name and which province and which state you are in the United States. So are you ready? Are you ready? Okay, don't write anything in the chat yet. Wait. The question is, how old you think I'm turning today? So how old you think I am today? I am not afraid of telling. I'm not shy of telling everybody how old I am. So let's see who is going to get 39, 37. Oh, Rainbow 222. You got it. Rainbow 222. Congratulations. I need to know your name, Rainbow 222. And can you please just you can just write your first name and where are you in the world? I need to see if you're eligible to win. Yeah, Rainbow 222, yes. Can you just say your first name and which state or province are you? So I'll check if you're eligible. I'm just waiting. Yeah, there's a 10-second delay. And for those of I'm just checking to see if this person is eligible or not, because if Rainbow 222 is not eligible, I'll have to ask another question. Okay, Rainbow, you are, Jasmine, you're not eligible. Okay, so I'll have to ask. Yeah, okay, thank you, Jasmine. So Jasmine, sorry, she's not eligible because she's in Australia and I can't send. So, okay, I will ask another question. So you still have a chance to win, okay? Are you ready for the next question? Okay, the next question, and I hope the person who writes this, you have to write in the chat exactly the exact words of the title of my new book. It's behind me here, so I'm going to hide it so you don't see. So what is the title of my new book? Okay, so the first person that writes exactly, it has to be all the words of the title. Okay. Steph, you already have a journal, but you could give it to someone else. Yeah. Yeah. So who wants to get, okay. Okay, I think you are unique and so is your pain, Kathy. Yeah. Kathy, that's great. I need to check if you're eligible. Kathy Gaultier, can you tell me where are you in the world? Well, you have to be United States or Canada. Tell me which province or state, and then I will tell you what is the email that you need to send. You are unique, and so is your pain. Very, very right. Yes, that's the title. Okay, let me see, Kathy. Saskatchewan. Okay, you are eligible. She's in Canada. She's in Saskatchewan. Kathy, so here is send the email to my support team. So it's support at Dr. I'm writing the chat, okay? drandreafurlan.com. Let me see if I didn't do any spelling mistake here. Support at drandreafurlan.com. Send me an email and someone from my team, I will sign the book for you, and send me an email In the email, please write the address in Saskatchewan, and I'll put in the mail for you. Someone will send the book to you. Congratulations, Kathy. I hope you enjoyed the book. And thank you, everybody, for participating today. I hope that next week we'll be here again to do another live at the same time on Wednesday. And if you have any suggestions for topic for next Wednesday, please let me know. And we can discuss anything about chronic pain, living with pain. And I wish you all a very good week. And thank you all for the birthday wishes. Okay, bye, everybody. Kathy, don't forget to send me the email, okay? Support@drandrewfurlan.com. Okay, bye.